My name is Jason Schillerstrom. I'm one of the assistant professors of psychiatry at the University of Texas Health Science Center at San Antonio, here in San Antonio, Texas. Today we are going to talk about depression, depression in the elders. And so from this talk, what I want you to learn is the criteria for depression, how depression is diagnosed. I want you to learn some screening questions for depression, and specifically screening questions related to risk of self-harm is what we'll particularly focus on. We'll talk a little bit about the causes of depression, outcomes of depression, why it's important to treat depression, and then we'll also touch on treatments and therapies, treatments both pharmacological treatments for depression as well as therapeutic treatments for depression. And so to begin with, we'll discuss the criteria for depression. And so let's see here. And so to be diagnosed with depression, there's specific symptoms that are involved in the clinical diagnosis of depression. The first one is pretty straightforward, is that a person has to have depressed mood. And in elders, this one can be challenging. And sometimes with elders, they may not say they feel depressed, particularly elders with severe cognitive impairments. So if someone has late-stage Alzheimer's disease, if we ask them, do you feel depressed, they may say no, they don't feel depressed. And so in children, the criteria can be modified a little bit to where the focus isn't so much on depression, it's on irritability. And so in elders with late-stage dementia, we too will sometimes ask the patient's care providers, do they seem depressed? And the answer might be yes, it might be no. Our follow-up question is, well, do they seem irritable? Are they easily frustrated? And so depressed mood would be the first one. Sleep changes. And so people with depression can have, they can either sleep too much or they can sleep too little. And the classic sleep pattern that we'll see in depressed and people with depression are what are called early morning awakenings. And so people with depression, they'll wake up at 4 in the morning and they just can't get back to sleep. And so early morning awakenings is kind of the classic sleep change. However, it could be that they're just sleeping all day. It could be that they just never sleep at all. And so sleep changes. Loss of interest. And so loss of interest is what it says. People no longer participate in activities that they used to enjoy. Guilt is pretty self-explanatory. Decreased energy. Decreased concentration. Let's see here. I'm going to match this up. Oh no, let's see. There we go. Appetite changes. And so appetite changes, again, might be loss of appetite. They just lose interest in eating. And a lot of times that's what we see in older people. In younger people, we might see the opposite, where they eat more than they ever normally would. Okay? So appetite changes can go either way, as can sleep. The next one would be decreased, what's called decreased psychomotor activity. And so again, this would just kind of be the that apathetic stance that you'll see, where they just kind of slump in the chair and they're not moving around as much. And then the last would be suicidal thoughts. Suicide, my spelling here. Okay, suicidal thoughts. And these are thoughts that life just isn't worth living anymore. And so the clinical criteria for depression are a person has to have a depressed mood, and they have to have 5 of these other symptoms for a period of 2 weeks or more. That's the definition of major depressive disorder. A depressed mood in addition to 5 of these other symptoms for a period of 2 weeks or more. And they have to feel this way for the majority of days, for the majority of time during that 2-week period. So there might be a moment, they might have had a good day. It's possible that they could have a good day. Maybe there was an anniversary or a birthday or who knows. They can have a good day, but in general, they feel depressed for a 2-week period. And if a person has a depressed mood and then these other symptoms for a period of 2 weeks or more, then that would qualify as a major depressive episode, and then they would be diagnosed with what's called major depressive disorder. There are other diagnoses of depression. So, for example, there's what's called dysthymic disorder. There's just kind of depression not otherwise specified where they don't meet exactly this criteria. So there's other types, but really to be diagnosed with major depressive disorder, what we commonly think of as clinical depression, this would be the criteria. And so I think what's important to know is that depression is an illness, and as an illness, it does have specific criteria. So we wouldn't diagnose someone with depression or major depressive disorder based on, a symptom here or a symptom there. It really is a clinical diagnosis with well-defined criteria. So that is depression. Next, I want to talk a little bit about screening. Actually, I'll leave this up. But I want to talk about screening questions for depression. And so in elders, probably the most commonly utilized screening instrument is what's called the geriatric depression scale. And there's different versions of this scale. The version that's used most commonly in nursing home settings and in geriatric psychiatry outpatient settings it's a 15-item scale. And so this asks questions like, do you feel happy most of the time? What I like about the scale is that it's always yes/no answers. And sometimes I have to beat a yes/no answer out of my patient. And so for some of my patients, it's I might say, do you feel happy most of the time? And the answer is, there's days where my grandchildren visit me and life is good and I had a good meal that day and I slept well the night before. But then there's other days where I, feel sad and depressed because I haven't heard from my daughter and whatever. And so for these screening questions, what I have to do is I always have to say, okay, the answer won't be yes all the time. It won't be no all the time. Just in general, most days, yes or no. Do you feel happy most of the time? Yes or no. And so we'll go through these screening questions. Are you often in good spirits? Might be another question. Do you feel your situation is hopeless? Do you think that most people are better off than you are? Do you have enough energy during the day? These types of questions. So there's lots of different screens. The one that's used most commonly is called the geriatric depression scale. It's a widely distributed instrument. And of these 15 screening questions, if a person gives a positive response, a positive depressive response to 5 or more of these screening questions, then we start to really think about a clinical diagnosis, the potential for a clinical diagnosis of the